Thank you so much. It is a pleasure being here, and it's a pleasure to be the next session after all the fantastic discussions we heard this morning. My task is to try to pick up on all the lines and all the themes we have been debating all this morning and apply entrepreneurship and innovation lenses on those. And just to warn you, I am an optimist in nature, so I do hope you will be a bit more optimistic by the end of the session as well. So we heard from the minister how in COVID we all pivoted to technology and started using virtual consults. I do hope that you know that behind this shift there is one phenomenal startup called Kovio, which is a spin-out from CSIRO. And it's driven by very much enthusiastic researchers, engineers, and entrepreneurs. In March 2020, it was a startup of the size of 5 people. By May 30th, it was a team of 30 providing digital consultations to Australians nationwide. And this is why this conversation matters, because innovation, entrepreneurship can really help us to solve for healthcare challenges in a very rapid way and agile way. We also spoke about this morning about empowering clinicians, researchers, engineers to solve for the challenges that they see in front of them. And my fantastic panel is an example of this, and we'll dig into this. We also heard and spoke about staff retention. And I would argue that providing innovation and entrepreneurship opportunities and training to the staff, it is an opportunity also to provide growth, professional career opportunities for them and retain them. We spoke about diabetes as the key issue, and I'm absolutely sure that Ashwani will be very much keen to comment on this, because that's exactly a startup that he is founder of, solving for this challenge. And last but not least, we also heard about the vision for LEAP, for Liverpool Innovation Precinct, to be a place for medtech of the future. And with this, I'm very much pleased to announce that just 3 months back, we, UNSW, in partnership with Liverpool Innovation Precinct, we have launched Liverpool Health Entrepreneurship Program to build a community of innovation and entrepreneurship across southwestern Sydney and making sure that we are solving for the needs of southwestern Sydney together with the community. But with this, it's really much enough of me speaking, because the knowledge is with our panel today. And I think, Ashwani, I'll start with you. I will give you my own bio and then you add on. So Ashwani is researchers with the George Institute for Global Health within critical care team. And his research area is sepsis and how do we improve sepsis care in Australia. In his very much spare time, he's also founder of a startup, Bunting Med, which is about making diabetes management more culture appropriate and affordable. So the question for you, Ashwani, how do you juggle these 2 specific jobs, and how do you wear a hat of clinician, researcher, entrepreneur, and what have been the outcomes of this? Do you see any synergies between those roles?
Thanks, Dina. I guess for me, it is not juggling, these different hats. It is more like a funnel. From my interactions, as a clinician, I hear what are the pain points for patients, and that really informs my research, what research areas I should be focusing on. And from research, really, and from my interaction with patients, that drives where I want to work as an entrepreneurship. So the idea of Bunting Med came from those, interactions with patients, that pain points, how patients with diabetes are struggling to manage their conditions. And obviously, as a researcher, the gaps in this area and the need for a solution which is culturally appropriate for everyone, not and which works pretty much everyone, not for a specific set of patients.
Yeah. So I guess we've been working with Ashwani and his team since 2022, I think. And the key thing that we've been very much excited to be supporting this team is this cultural appropriateness of the intervention. So it's not one size fits all, but there's a specific vision of designing intervention that fits for the community. Joseph, you are PhD graduate from Ingham Medical Institute. You'll get it right.
Ingham Institute of Applied Medical Research, yes. Yeah.
During your PhD at the institute, you saw a problem, you started a company, and then can you just describe your pathway from there and why you are now both medtech startup founder part-time and part-time leading a startup accelerator program at UNSW?
Of course, so I'll try to keep it short, but out of my PhD a few years back, we were looking at cancer cytology and diagnostics. At the tail end of our PhD, we were kind of struggling with available technologies to do what we needed to do. We thought, surely we could just make something, 3D print a small piece of plastic to help it be more efficient and far more cost effective, which turned out to be true. You know, we didn't have the vision initially to start a company. It was we just needed something to work so that our processes were more efficient, cost effective, and accessible. And I think that kind of resonates with a lot of the Southwest Sydney and Greater Western Sydney technologies and innovations. From there, my co-founder of that cancer cytology diagnostic company, we found out that we're both sleep apnea patients. I'm borderline severe obstructive sleep apnea, and I was not entirely impressed that CPAP was my only option or the splints. Again, so we kind of thought, you know, surely we can come up with something in-house, develop something that we can do proactively to kind of treat ourselves. So that's kind of the genesis of the second startup. I was, incidentally, a participant of the Health 10X program at UNSW Founders. The team were awesome. The ecosystem was fantastic. And it gave us everything we kind of needed to continue commercializing. So roundabout, I ended up coming back to support the Health 10X program, which I'm currently doing.
And back in May, Joseph, of course, was proudly delivering workshop in Liverpool as a part of our health entrepreneurship program, just bringing everything that he learned through the journey back to the Southwestern Sydney community. Thank you, Joseph. Brendan, can you just unpack a bit about your journey? So physiotherapist, but then now a project manager for this leading assistive technology hub. So what is entrepreneurship for you, and what have you been done differently outside of just research framework that led to you to the outcomes that you're working on now and technologies that you have in place?
Thanks, Dina. So as you said, I'm a physiotherapist, and I started at the Ingham looking at setting up a project which was going to support people with a brain injury, their supporters, and also clinicians access assistive technology. And so we saw that people had this assistive technology already in their hands, already in their homes, but weren't utilising it. And so we wanted to be able to support them to do that. So part of what we were doing was doing some research around how can we help people in the community use this technology. And what we found is we were using some specialised technology or mainstream technology which wasn't quite fitting the need of those people. So as Joseph said, we found that an idea came out of the research that we were doing, and how could we make a better product to support these people? And not just people with a brain injury, people with dementia, people with an intellectual disability. And so we then have just started partnering with the CSIRO to try and develop an idea and a product that could fill this gap. And yeah, so it's been a really interesting and exciting journey, and wouldn't it be possible without an organisation like the Ingham for us to be able to do research, clinical work, education and training. So it's a great mix.
I also would like to point out, I really like how you engage with patients and with community, and how you co-design something for the purpose of the community. So you do go out of the walls of the institution and using the principles of co-design there. Joseph, I can get back to you because I know that's your favorite topic. So we all know that Australia tops when it comes to output of our health and medical research. Our researchers are highly cited, we are well respected, and quality of our research outstanding. We also know that when it comes to patents submitted and basically the innovative index, what they call it, of our research, we are below OECD average. And I do know that you are very keen to speak on this topic tonight. So from your experience of, again, transitioning out of just researcher role into the industry and a startup, what shall we, as a community, as government, industry, healthcare providers, you name it, do all together to be better at translating our brilliant research into not less brilliant also outcomes?
Yes, you're right. I love talking about this. Yeah, in that the export indexes for Australia, we are world class with the research outputs, world class with developing patents, but we're on par with third world countries of what we're actually manufacturing and developing and innovating within Australia. And that was reflected, at least with my experience at the Ingham. We were sitting amongst world class researchers. We had the hospital immediately next door with clinicians who were really passionate. But the culture at the time, and this was several years ago before the Assistive Hub, but there was lacking the commercialization supports. There were researchers with a wealth of clinical data coming out of trials, but there wasn't an obvious link between that and going to commercial. And it does take a lot of different supports. This is across clinical trials, service providers, technology providers. It's really important to kind of bring that together in one centralized hub. We're lucky at UNSW Founders. We've been doing this since 2018, if I have that right. But we need to see more of this in Southwest Sydney and Greater Western Sydney. And my view, it's a bit, we're talking about how amazing the Ingham is, but that's where I came from. I see it as a hotspot for innovation, but we desperately need all of those supports and a hub and an ecosystem set up there.
Thank you. I do hope that event tonight, it is an opportunity to create this hub and a platform and for all the stakeholders to connect as well. We do have some questions coming in, and can I just pick up, how do we drive innovation within the constraints of the current financial environment? Well, I may just pick up and just remind everyone that Joseph has 3 jobs. He is part-time with us, while in other part-time he is innovating. So that's the reality as of today of driving medtech innovation. But otherwise, there are some other sources available financial to secure through collaborations, through grants. Though, of course, we sound like a broken record that we would like to see more funding going towards health and medtech startups in New South Wales and Australia globally. And there was one more on collaboration. What does collaboration look like in the innovation and entrepreneurship space? How do you forge connections that help to bring that innovation as wide as an audience as possible? Joseph, do you want to start, and then I can give some more updates?
So much of the same to my previous point. So having the central point where everyone knows to go to. We see a number of startups coming through our accelerator programs where they come to us saying, I actually need a clinician in this space. And we have a very clear network across UNSW where we know who are the kind of key players or the champions or the door openers at each of the faculties. But this has taken many years, and it takes a lot of support through the community over time. The output of that is incredible. Clinicians get to see impact with patients. The commercial entities get to connect with the clinical researchers that are leading in their respective therapeutic areas. So my sense is that we actually need those ecosystems. It's one of the first things.
Brandon, Ashwani, go first.
To add to the point made by Joseph, so as a clinician, as a researcher, when I thought about, okay, I have this idea and I want to, start my own company. To be honest, I had very little idea that how to go about. I know that I have good idea. This is a pain point from patients, so there is a need. And I have had this conversation with many of my colleagues. I work at a medical research institute, the Johnson Institute, and many of them, they tend to have good ideas, but what sort of scares them or that they fear about, okay, how do I go about doing this? And it's as simple as, setting up your company, very basic things. And that's why that's the value of, having a health 10x. So when we entered, when we joined the 10x accelerator. We thought we had done our customer discovery. We know what's our target market size is, but we were proven wrong. And I'll be first to admit that. And we learned that there's so much more which was to be done, which needs to be done for us to have the clarity of our business model, or be it our, the term which I'm using, they seem very, very foreign to, if you talk to a researcher or a clinician. And I guess, talking about the the commercialization, and we need to bring that mindset shift, that this could be an option for the research, that you can commercialize your research, and it's okay to think on those lines, and then having the support which Joseph mentioned, to make that happen is the key.
Thank you, Ashwani. Brendan, we have one of the best rated questions. In what ways is the local community involved in health innovation? Can we just unpack how you worked on your project with the local community and then take it from there?
Yeah, so I suppose we're in a really good position because the work that we do is community-based work. So the research that we're doing is based on individual person's needs. So it's very person-centred. We go out and we meet with someone who has a brain injury and try and identify what are their strengths and what are their weaknesses and how technology can fit in with that. So we're not testing one single product, we're testing a range of different things based on the person's need. And we're able to get some really great feedback in terms of what works and what doesn't in that scenario. And what we're trying to do is then work with those community clinicians, so community health, but also private clinicians, not-for-profits who are out there working with people in the communities to build the strength around using technology. And I'll just take one step back as well in terms of a really good practical example of how we're building those connections. The Assistive Technology Hub was really set up to build a linkage between patients and clients, clinicians and those developers. So one of the successes we've had recently is we've partnered with a startup called Neuroimmersive. They're a VR rehab company, and we were successful with a MVP grant in terms of developing a new upper limb device which would provide haptic feedback and electrical stim, which would integrate with their VR system. And what we've done is we've linked them with the clinicians in the brain injury unit at Liverpool Hospital to do some feasibility trials. So that product is in development, and we'll be working with clinicians and with patients in the unit to understand how it works, what works well, what doesn't. So it's been a really practical and great linkage, and that wouldn't have been possible without building those networks and collaborating with other people.
Yeah, I absolutely love how your AT Hub is set up. I think it's just exemplar of the community co-design and collaborative principles as well. There are so many great questions. I literally want to answer all of those, but maybe a very, very popular one that we receive. Not all clinicians want to be startup founders. What structures do we need to put in place to bring this research innovation into a commercial pipeline? It is true, not all clinicians do have time, but what we try to engage, how we try to engage with clinicians is just for them to act more as an advisors. So they either come with an unmet clinical need they want to be solved, and then there are groups of researchers and engineers and designers who can co-design this solution with clinicians. Clinicians not driving this. They are the owner of the need. Or for more progressed stages of a company, let's say, it is almost about to launch a solution into primary care practice. It then comes to advising the company of things to do and not to do, and this addresses another question. How do we introduce new technologies that are not a burden for a clinician, but it's actually a value add? It comes through the right approaches and processes that we teach within our community and networks. And our ask for clinicians today is just not be afraid of the word entrepreneurship and innovation. It's not always about jumping on stage and pitching like Elon Musk. Sometimes it's about letting us know what matters and whether the way of solving for this issue is actually the right one. And we struggle with having access to clinicians because, of course, they're very busy audience as well. This will bring me more to few takeaways from each of the panel members, because what I would love to hear from you, very much personally, what will be your key ask or a thought for the community for today? What would you like to see happening more or less of in the health innovation ecosystem in southwestern Sydney? What do you personally looking forward to? Brendan, maybe we'll start with you.
I suppose it was mentioned earlier, collaborations and partnerships. That's been a real strong feature of what we've been doing, and building structures that will allow clinicians and researchers to work with the community. And one of the things at the Ingham which is being developed is the Perich Centre for Robotics, Health Technology and Medical Devices, where we're looking at bringing a range of different disciplines into one central space. Those sorts of structures are really important to bring about that innovation, discussion and new ideas. And obviously looking at how we fund those things. So our next step in our project is to try and do some co-design. So we're looking at having people with a brain injury and clinicians come together, look at the prototype we've developed and give us feedback. Because I don't think clinicians will take it on, or people with a brain injury or any patient will take something on if they haven't been involved with the process. So we're looking at trying to identify funding options to be able to develop these sorts of ideas at an early stage before you're even got to that commercialisation point. So
funding towards strengthening the collaboration further and continue co-designing to bring solution to the market.
Yep.
Money. Joseph?
Money. So I really completely agree. And so we've been fortunate to establish the Health Entrepreneurship Program in Liverpool with Ingham Institutes and LIP. I think something also needs to be set up in Western Sydney or Greater Western Sydney, something where, our platform acts as, our platform at UNSW, the Health Technics Accelerator, serves as a kind of starting point for a lot of companies coming in, guiding them on the process in those early stages, which we also help with finding funding opportunities. So setting up another hub that's not just money, it's also service providers and technology providers. So that would be my first step, big win for Greater Western Sydney.
Ashwani, as a researcher, clinician, founder, what is on top of your wish list?
I guess, as a founder of Banting Med, which is a culturally appropriate, virtual care platform for diabetes, currently, although we are focusing on India, which is a diabetic capital of the world, but soon we plan to bring our solution to Australia, and I guess Greater Western Sydney is the ideal platform with multi-ethnic population, and particularly the diabetes burden being very severe in the region. So I would love to have a chat with people who are keen in this space at the break.
That's a good one. And one of the questions is, what do you feel are the gaps and challenges in the current innovation precincts across Western Sydney that are hindering the potential for growth and impact? I feel, Joseph, you touched a bit about this, about creating a place for community to come together, collaborate. Anything else anyone wants to add when you think about precincts and how they operate across the southwestern regions, and how you personally were or were not able to engage and benefit from them?
This is more university related, but also to an extent medical research institutes. The policies that are in place to coordinate the intellectual property out so that they can then be commercialized, it's really important to get this right early on. We see phenomenal things over in, say, Imperial College in London, say Stanford in the US. I think we need to be adopting a lot of these principles across Australian universities. UNSW has a pretty good framework to do this, but we do need this kind of spread across universities, so we're not handcuffing the researchers who want to then commercialize to be stuck within the university.
Thank you so much. And one more question. What are the main challenges, I guess we'll stay with all of you, the gap between academic research and entrepreneurship in the health sector? So just for all of you personally, juggling these two different aspects, what are the challenges of doing both and bridging the gap between being a researcher to trying to do something outside of a normal framework of research?
Maybe I'll start. So I guess major challenge is that when I'm wearing the hat of founder of Banting Mad, then, if you become too researchy, quote unquote, then it sometimes can be a hindrance because you, as a researcher, your goal is to have a NEJM or JAMA publication, whereas as a founder of a startup, your goal is to do a pilot study which is feasible and do it quickly, and you don't want to get a JAMA or NEJM or Lancet publication. So I guess it is every time you have to remind yourself what hat you are wearing and then actively think on those lines. And again, as a clinician, and this applies to especially, when you are wearing these, you have to juggle between these different roles. But as I mentioned in my, first response, it also informs all these different roles, right? And I've been lucky to have these different roles, and which the interaction in your experience in different roles really helped me in doing better work, being a better researcher or being a better entrepreneur, so to speak, and also being a better clinician.
Thank you. That's all what we have time for in this session, but you can grab Brendan and Joseph and Ashwani in the break. What I would love to finish with is that we always say that entrepreneurship is just a tool. I know it's a word that sounds fancy. In reality, it's just a tool that teaches you to identify the problems worth solving and finding the solutions that are the right ones to solving those problems. And we believe that community in Greater Western Sydney deserves to have access to these tools as much as the rest of Sydney. And we are very much excited that we started this journey in the region just 3 months back. And hopefully in the upcoming health forums in the years to come, we will be able to share more success stories. Thank you.